Hi, my name is Stephanie Engel. I've been a registered nurse for 10 years, and I'm currently pursuing my bachelor's degree in nursing. I'm taking a class about caring for communities, and I've created this slideshow presentation to increase awareness of the importance of maintaining good oral hygiene. We have all heard that we should brush our teeth twice a day and floss, but rarely do we understand why we're told to do these things, and oftentimes we're not aware of how our choices are impacting our health. So let's take a closer look and evaluate how is your dental health. In this presentation, I hope that you'll be able to gain awareness of the importance of dental health to overall health and well-being, as well as be able to identify one poor choice that you're currently making that may be leading to poor dental health, and then identify at least one choice that you can apply to your life that will make a positive impact on your dental health and ultimately your overall health. A healthy body. So poor dental health can impact many organ systems, including the heart, brain, lungs, and even the reproductive organs. Let's take a closer look at how the heart can be impacted. The bacteria from chronic inflammation of the gums can enter the bloodstream and travel to the arteries, causing the arteries to harden, which interferes with how the blood will flow and increases the risk of heart attack and stroke. This can also cause the lining of the heart to swell or become infected. And the brain can also be affected by poor dental health. Because of the bacteria in the mouth from gingivitis, it can enter the brain through the nerve channels and lead to dementia. Respiratory infections are another consequence of having poor dental health. Breathing in the bacteria from the infected gums over a long period of time can cause pneumonia. And current evidence suggests that bacteria and inflammation that begin in the mouth can travel even to the uterus, causing inflammation and can lead to premature birth. So the basic cause of all of these issues is the bacteria in the mouth. And we're going to take a closer look in a few minutes of what we can do to decrease the bacteria in the mouth. Let's take a look at some choices that lead to poor dental health. One is alcohol use. Alcohol use can lead to cancer, bad breath, tooth wear, and cavities. Substance use, such as heroin, can lead to cavities and periodontal disease. Opiates can cause tooth loss and decay. Cannabis use can lead to oral cancer, inflammation, and dry mouth. Stimulants like cocaine can lead to burns and sores in the mouth, as well as receding gums. Methamphetamines can lead to tooth wear, dry mouth, as well as excessive cavities. Smoking increases our risk of tooth decay, receding gums, periodontal disease, lesions, bone damage, tooth loss, and jawbone loss. Diet is a very important factor in dental health. The amount and frequency that we are eating, the kinds of foods that we're taking in, like sugary foods, acidic foods, can all decrease the enamel on our teeth, just break it down and make it more prone to getting cavities. Frequent snacking, chewing on hard candies or ice are also not good for our teeth. Inadequate brushing and flossing allows the bacteria to build up and cause further decay. That we can do to improve our dental health, some positive choices that we can make. Making better dietary choices. Calcium helps strengthen our teeth. So increasing calcium, drinking milk, yogurt, things like that are good for our teeth. It decreases the risk of cavities. Increasing water intake is another thing that we can do to help with our teeth. It kind of washes the bacteria away. Limiting snacking on foods. Like eating foods as part of a meal causes less harm on the teeth because increased saliva washes away the food particles, causing less harm to our teeth. Also, chewing sugar-free chewing gum can be helpful because the xylitol and the sorbitol found in most sugar-free chewing gum is slowly absorbed by the oral bacteria or not absorbed at all. So gum increases it also increases the saliva production and can wash away the acids made by the oral bacteria. Another important thing that we can do to help with our oral health is to make sure that we're brushing our teeth twice a day and flossing once a day. And also, seeing our dentist regularly is very important because with regular dental care, our dentist can help prevent problems from occurring and catch those that do occur at an early stage where they are treatable. At poor dental health in children, cavities are the most common chronic disease of childhood. Why is it so important? It is important because if children have cavities that are untreated, it can cause a lot of pain, and that leads to school days lost, lower grades. It interferes with their learning and sleeping, which can also interfere with their immune system. There changes their eating habits. It can affect their growth and their weight gain. Another concern for dental health in young children is baby bottle tooth decay, and that's caused by leaving sweet liquids on the teeth, including milk. Sometimes we don't think of milk as a sweet liquid, but leaving milk on the baby's teeth for long periods of time can cause decay. And one thing that we should not do is put sugary drinks in a bottle. One thing we can do to help prevent baby bottle tooth decay is to wipe the gums after feeding and begin brushing your children's teeth when the first tooth erupts and flossing at 2 years of age if their teeth are touching. Kids have healthy teeth. One main goal is to help prevent cavities, so decrease their snacking. Teach them the healthy habits of brushing twice a day and flossing once a day. Avoid sugary foods and fruit juices, and if they are eaten, have them rinse their mouth after or brush their teeth after. Fluoride is very important because regular use of it toughens the enamel and therefore protects the teeth from decay. I just want you to be aware that fluoride is a neurotoxin, so make sure that your children are not ingesting it as it can lead to developmental disabilities. This is why it is important for children to learn to make sure they're spitting after they brush. Ask for dental sealants for adult teeth. Adult sealants are a protective coating applied to the chewing surfaces of the teeth. They prevent 80% of tooth decay, and only 1/3 of kids between the ages of 6 and 8 have these sealants. So make sure when you do see your dentist that you are asking about dental sealants. Over here to the left, you'll see some important ages things to think about when you're taking care of your children. So if you have a child 0 to 1 year old, you want to make sure you're wiping their gums after babies are drinking their milk. Also begin brushing their teeth when the first tooth erupts. It's also a good time to see the dentist because the kids will just start to get acquainted, used to going to the dentist, so it's not a scary event for them. When your children reach 2 years old, you can start teaching them to spit their toothpaste out. When they're 3 years old, you use a little bit more toothpaste, a pea-size amount, a little more than you would for a 1-year-old or 2-year-old. And when your children are 6 years old, you can start to ask for dental sealants. And that's when they start getting their adult teeth. So that's a good time to ask. Even when children are 8 years old or 9 years old, they still need some supervision, some reminders to make sure that they're brushing their teeth well. Preventative care is so important because it lowers your risk for developing tooth decay, gum disease, and even more serious dental problems. So early identification of dental problems can help to minimize treatment costs as well. Thank you for watching. Please feel free to leave a comment below or share something new that you've learned or something you'd like to add. Thank you very much for watching this presentation. And please keep in mind that our dental health isn't just to make us have a pretty smile. It actually keeps our entire body healthy by taking good care of our teeth. So keep that in mind. And also at the very end of this slideshow, after the references, there is a little evaluation form. If you fill that out and answer those questions and bring it to Lifesavers Ministries, they have free dental care kits that you guys are welcome to have for your families. Thanks again for watching. I hope that you learned something from this presentation.